Welcome to Mom and Mind. I'm perinatal psychologist and host Dr. Kat. There is more to the story than just postpartum depression, and this podcast aims to share it all, from personal stories and lived experience to experts who break down the ups and downs of life, from getting pregnant, pregnancy, perinatal loss, and postpartum adjustment to new parenthood. While this is not psychotherapy or medical advice, it is all of the stuff you ever wanted to know about mental health and new parenthood. Welcome to Mom and Mind. I am your host, perinatal mental health certified psychologist, Dr. Kat. In this episode, we are diving into the topic of postpartum depression. What is it? What are the risk factors? And what are some of the long-term effects of postpartum depression if left untreated? Our guest today, Dr. Kristina Deligiannidis, received her medical degree from and completed her psychiatry residency and chief residency in psychopharmacology research at the University of Massachusetts Medical School. After residency, she completed a visiting fellowship and further training in multimodal neuroimaging at the Massachusetts General Hospital, Martinos Center for Biomedical Imaging. She joined faculty at Zucker Hillside Hospital, the Feinstein Institutes for Medical Research, and the Donald and Barbara Zucker School of Medicine at Hofstra, Northwell in September of 2016. She is board certified by the American Board of Psychiatry and Neurology and currently serves as the Director of Women's Behavioral Health at Zucker Hillside Hospital. As a reproductive psychiatrist, she has expertise in treating women with mood and anxiety disorders linked to the menstrual cycle, pregnancy, postpartum, and perimenopause. And we are so grateful to have her on today, so we are going to dive right in. Let's meet Dr. Deligiannidis. Welcome, Dr. Deligiannidis. Thank you so much for being with us today.
Thank you so much. It's my pleasure.
Really excited to get into our topic today. A lot of people have misconceptions around postpartum depression, and I think we'll be able to give people a lot of information to help them really understand how postpartum depression manifests and what it is, and also to be able, from your perspective as a professional, as a clinician, the things that you see on your end with patients. So I would love to first start with how you came to this specialty.
Sure. So it was definitely a long-term trajectory. If I look back, even in college, I was always really interested in the brain and in hormones. And then in medical school, I absolutely loved my obstetric rotations and my psychiatry rotations, and anything to do with hormones in the brain and women's health. It seemed to be where I wanted to be. And so in residency, I decided to do a psychiatry residency. And it was actually my first year as an intern. And I was asked to take care of a woman who presented to our inpatient unit soon after she delivered. She gave birth maybe just a couple of weeks. And she presented with postpartum psychosis, obviously different than postpartum depression. But I was so impacted by her presentation. Her, this is a woman who didn't have any history of depression or anxiety or anything, and how quickly after delivering this beautiful baby, her psychiatric symptoms began, and she was unable to care for herself or her baby or for her family. And so I was just struck of how giving birth, how having a baby and delivering a baby could bring about such changes for a new mother. And so I've really dedicated my life to leading the research to understand how perhaps female hormones during pregnancy and after delivery can trigger changes in the brain, and educating women and caring for women clinically, for women who develop perinatal mood and anxiety disorders, especially perinatal depression.
Yeah. Well, that is such an interesting introduction into the perinatal mental health world, right? That witnessing somebody experiencing those symptoms is quite a thing.
She's impacted me for my life. I mean, I can still think of her family, her baby. She did very well with treatment, but it was a devastating, impact for her and her family. And that's why we're here today. So
yeah, absolutely. So in terms of the shift into your research and postpartum depression, what kinds of things are you looking at?
Well, as you know, postpartum depression is a major depressive episode that can occur either during pregnancy or after giving birth. So our research has really focused at looking at different sex steroids and hormones that our bodies make as women especially in large amounts as we progress in pregnancy and then fall off or crash after delivery. And I use brain imaging techniques to try to understand how those hormones interact with brain function. It could potentially act as a trigger for developing the main signs and symptoms of depression that we see in women during this time.
I would love for you to share with us anything you can about this research so that, I think I know for sure a lot of people who are experiencing postpartum depression feel, like failures and feel like they're doing something wrong. So the fact that you are looking at very specific physiological brain components to this that can help us understand this, as opposed to, let's say, blaming ourselves, that's so important for the person who's experiencing it. Before we get into those kinds of details, can you walk through a little bit of what is postpartum depression?
Absolutely. So for each woman, it can be different, but the women I see and take care of usually, report to me a mix of emotional, physical, and other symptoms. And so things that I want women to look out for are depressed moods, so sadness, loss of interest and pleasure, and the things that they used to love. Women will stop and, they'll stop doing their hobbies or activities. They won't be looking forward to the baby shower. They won't be looking forward to the delivery, or maybe they're not enjoying their little one as they thought they would. The sleep difficulties that they report, it's not just about being pregnant or just having to wake to feed an infant every couple of hours. These are difficulty falling asleep, difficulty staying asleep, early awakening. The appetite disturbances we see, women report severe, usually loss. Women can have increased appetite too, but I find that many of my patients report really a loss of desire to eat, a loss of the taste of food just isn't there anymore.
Yeah.
Some women present more irritable and anxious, agitated. And then often women, as you know, they feel guilty. They feel that they brought this on, that there is some sort of internal weakness, and they can feel worthless or helpless or hopeless. And then, a subset of women in severe depression, they can think about, that because the guilt is so overwhelming, they feel like that they're not doing their part, they're not contributing, they're not being the mother they should, quote unquote, should have been. And they start to wonder if, the family would be better off without them.
Yeah, those are such difficult symptoms to experience while having a baby and having to take care of somebody else and trying to figure out which way is up. That's without postpartum depression. Things can feel like that. So there's a lot of misconception around postpartum depression and baby blues, and I often hear people mistakenly call baby blues depression and postpartum depression baby blues. Can you help us differentiate between the two?
Of course, I hear this too from patients, from families, from clinicians, where the distinction is still challenging. And so, I kind of think of this as there's a couple of things that are really different. And so we can focus there. So really one of the main things is severity. Then I look at onset and then the duration. And so baby blues are really characterized by more mild symptoms. They can start or peak several days right after childbirth. And they can include, some similar things. They include some mood changes, feeling like your mood's, quote unquote, on a roller coaster is what I hear. Women are worried, especially if there are some complications or with their delivery or with the baby's birth. There can be tearfulness or some irritability, some sleep difficulties. But, mom's not impacted in her ability to care for herself or for her family. She can feel overwhelmed, but still there's not that impact. I try to make the difference that moms will say to me, I find myself having these episodes of crying and I just don't understand why, because I'm happy to be a mom. I know I'm like stressed out right now, but I'm like happy to be a mom, but I'm crying. Is that postpartum depression? And so you see this sort of lack of a link between their mood and their symptoms. So the mom's mood, is happy, she's elated, but she's crying. So that is a key that we put baby blues. Rather, with a mother with postpartum depression, she does have feelings of sadness and loss of interest that are linked to the periods of tearfulness or crying. And then if we look at the duration, these symptoms of baby blues will resolve usually within 2 weeks. So that 2-week marker is really important because the symptoms of postpartum depression, when untreated or undertreated, may persist for months or over a year. So it's postpartum depression is not the same for every woman. It definitely goes beyond just, sort of the brief mood symptoms that many of us feel after delivering a baby.
I think you mentioned a little bit earlier in some of your work that you're looking at what happens after delivery in terms of brain function and hormones and whatnot. Would you be able to talk a little bit about why that baby blues period of time feels that way?
Yeah. So, it's surprising how little research has been done on women during pregnancy and postpartum, given that many of us go through that experience, sometimes once or multiple times.
Mm-hmm.
And, I think it's just it's a disparity that we have to get beyond. And so there's more research in men than women. And so we're going there and we're going to figure out these answers. And so what we found is that, the brain undergoes changes due to these hormones that we naturally make during pregnancy. The hormones have so many functions to prepare our bodies for the development of the baby and the birth of the baby. But our brain undergoes changes too, because the hormones prepare our brains to be mothers. And so it's important for our brain to make this transition, and the hormones are a piece of that. What we find is that when the hormones then drop immediately after the birth, that the brain then has to make an adjustment to the low hormone state. Mm-hmm. And so for some women, there's no perturbation. So there are no mood symptoms, no emotional changes, no behavioral changes. They're kind of able to do that reset sort of very quickly and smoothly without any symptoms. Then there's a group of mom, and there's the majority, it could be as high as 70% of us, where it's a little glitchy. And so there's, there's some symptoms of, tearfulness, or feeling overwhelmed, little irritable with our family members and others.
Oh, sure.
And that just takes a little bit of time. And that's why it's a short period of time, because the brain is able to adapt to the new hormonal setting. But then there's a subset of women, and we've shown that their hormone levels look different in pregnancy than women who are able to reset without problems. And so already in pregnancy, the hormones are looking different. And after delivery, they continue to look different. And then our brain imaging research is showing that the women who develop postpartum depression, compared to the women whose brain are able to reset pretty quickly without any glitches, look different. And so the brain is, really the different parts of the brain are not communicating with each other in the way they should. And so this really is a medical complication of pregnancy and delivery. And we're looking at this with pictures of the brain. And sometimes I show the women who participate in my research, she's like, you can see this in my brain. I'm like, we can.
That's awesome.
and it just, it gets rid of this horrible stigma that they've done this to themselves, or that they deserve this, or that they're a bad mom. And I'm like, no, just like I can check your blood sugar and get a number, I can show you your brain and show you what PPD looks like. And so that's why we're doing this research. And obviously to better predict who, might have challenges with this transition in the future, so that we can predict who's at risk in a little bit better way than we can right now.
That is so exciting. Oh my gosh. Yeah, I'm just thinking of all of the, people sitting out there who are pregnant and just had a baby, and this information, just what you said, that we can see this in your brain and it's not a you thing. It just is incredibly relieving. And I think, I hear a lot like, well, isn't it just the same as regular old depression? Yeah. What's the difference between postpartum depression and regular depression? And I think you just laid it out beautifully. There's a major difference, both because of the contextual factors of now, being a new parent, and all the transition that happens with that. But there are brain differences. Yeah. I mean, what you are describing is that there are real, actual differences that are happening for these folks. Yeah, it's incredibly relieving. I'm really excited about the work that you're doing.
Thank you.
What are the risk factors that would put a person in a more likely position to develop depression in pregnancy or postpartum?
Yes, women are more likely to experience perinatal depression. That's the depression either in pregnancy or after delivery. If they've had a personal history of depression in the past, if they're under increased stressors, they may have had a history of some traumatic event, but also if they're received minimal support from family, friends, or community compared to women who receive that support. So we know that even in women with a history of depression or some of the other risk factors, that maybe we can't change, there are things that we can do to support women throughout this perinatal period and even into what we consider the fourth trimester, which is a term now used by the American College of Obstetricians and Gynecologists, of these 12 weeks after delivery. So it's not just, okay, the baby's out, it's there and beyond of providing support to women to reduce the risk of perinatal depression at that time.
Would you be comfortable with going in a little more depth to like what it can feel like for the person experiencing it, like what their experience is?
Yeah, so the majority of moms that I speak with in my clinical practice really share feelings of isolation and really a loss of self. There's the signs and symptoms that we use as our diagnostic criteria, right, as psychiatric professionals. But then there's this theme of isolation, loneliness, and a loss of identity. Like they don't know who they are anymore because
Mhm.
they all of a sudden they tell me they just sort of exist to take care of this little baby, and they had to feed it and diaper it and make sure it's safe and do all these things, and that their own needs or sense of self has disappeared. And that's a real abrupt change for women. And without support, I think that becomes a big risk factor for perinatal depression in many women.
Sure. So, I don't know what the numbers are currently or the guess is in terms of who actually gets support for this and who doesn't. I guess that largely depends on who's seeking support and what kind of questions are being asked when they go and see their providers. But there are many people who are suffering and don't get support, don't get the help that they need. What happens for those people? What are the long-term effects of postpartum depression?
Yeah, so there are effects, on obviously the new mother, and so she's impacted by the symptoms. It's really hard to even get through a day. It's hard to take care of the baby, and if she has other children, other responsibilities, inside or outside the home. Never mind do her own self care and wellness. But also there's impact on other family members. So the partner's mental health is impacted, we know from research, and also the children in the family. And we know from many decades of data that mom's symptoms can interfere with her ability to really, attach to, bond, and provide the emotional support that the infant needs in those very early days. And so the infant's mental and emotional development can be altered as well from postpartum depression. So it's just, I mean, from any way you look at it, but, we have to care for mother. We have to
Mhm.
care for mom. And in pregnancy, we have to do a better job of supporting mothers during this period of time for mom's sake and for the
Mhm.
baby's sake and for
Mhm.
family's sake, for society's sake.
Right. Yeah, absolutely. And going back to pregnancy for a moment, in terms of, the people that I meet with, moms who are pregnant and experiencing the symptoms of depression, sometimes very severe depression during pregnancy. There's a lot of hesitancy around, even therapy sometimes, but certainly even once they're in therapy, accepting the help of and support of medication becomes, sometimes a struggle for them because they're worried about, oh, if I take a medication, it's going to hurt my baby. But what they don't quite know is that the depression itself might have an impact on pregnancy. So, what happens, I guess, what are the risks of untreated depression in pregnancy?
Yeah, so there are risks of untreated depression in pregnancy and after delivery, and they're a little bit different. And so we really do strive. We see this so often that, women who even come for an evaluation are maybe not ready to accept either any of the psychological therapies or medication options that are available. And so, we want women to understand that not treating depression is not without risk, right? And so we know that women, especially with more moderate severe depression in pregnancy, can have higher rates of birth complications or earlier delivery, smaller babies delivering sooner than women without depression. But also then, we're still trying to understand how stress and depression in a pregnant woman can have effects through the placenta to the unborn baby and beyond the birth complications, but with the baby's brain development going forward. And so there are now brain imaging studies that other groups are doing on these little ones, like 2 weeks after birth, that are trying to see the difference in brain development when babies are born to women with depression or born to moms without depression or anxiety. And we're seeing differences in that brain development. And so now studies are following those little ones as they develop to see how we can support both mom and the baby's child development, going forward. There are risks when we don't treat. And as you noted, it is challenging. It is, we just stick in there with the mom, and it could take a couple months before she's ready to maybe participate in a group psychotherapy. We educate. And then, for more severe cases, if medication's indicated. But really, we want to really encourage women to have the support that they need from friends and from family. I can't underestimate that. I can't state it enough, but also evidence-based psychotherapies and interventions for them as well.
Absolutely. I feel like, especially for women who are dealing with very severe symptoms, they feel the depression itself makes it harder to move forward with other kinds of support, like some even groups or, as you said, if needed or if indicated, a medication. But the depression itself makes it hard for them to accept the help because they are often just feeling like failures. And sometimes there's a lot of, that feeling of, well, I should be able to do this myself, or that they're so protective of the baby in pregnancy that they don't want to hurt the baby. It's just a really, really difficult spot when the sort of disease of depression itself is the barrier sometimes to getting that help.
Yes, there's actually a recent survey done by Healthy Woman. It's a nonprofit National Women's Health Resource Center, and they recently conducted a survey of more than 1,000 U.S. adults. And they found that 9 in 10 moms feel the pressure to do it all on their own after the baby's born. So exactly as you said, there's this strong feeling that they're going to push through it and they're going to do it and they're going to take care of that baby. And, again, in this study, of those who said they would not discuss their postpartum depression symptoms with anyone, a third of them cited not wanting to bother anybody. Others said the guilt and the embarrassment. Can you still believe that in this time where we're having women feel guilt and embarrassment and not wanting to bother others? And so yes, you said it exactly. That's what we're still seeing today of moms who are not feeling are not empowered to get the help they need and support they need at this critical time.
Wow. Yeah, that just highlights how much work there still is left for us to do. There are not enough mountaintops, apparently, to scream this from, that it's not a them problem, and that there's help. So in terms of prevention or lessening intensity of symptoms or preparing, having a plan of care, what can people do to prepare for life with the baby in these early days?
Yeah, so it's, I think all the preparations that women are accustomed to doing are, getting the nursery all set and getting the car seat and reading the books that you're going to need, and to figure out how many times is the baby going to pee, and how often do I need to feed them, and sort of all the basics. But I think what doesn't happen is that they fail to develop a plan for the postpartum period after the baby arrives, and to ask the difficult questions about what could I potentially need to, transition emotionally into this period, and how can I prioritize my emotional health? Do I have a support system in place to help with this transition? And who will I turn to if I'm overwhelmed? And so, again, from that survey by Healthy Women, 76%, said that they created a birth plan leading up to the baby's arrival, but only 21% created a plan that focused on their own emotional health after the baby was born. And we just know from many other studies outside of this one that lack of support and a transition plan in this postpartum period is associated with higher rates of postpartum depression. And we do know that also a higher percentage of Hispanic and Black women report inadequate social support and poor access to their healthcare providers in that early postpartum period compared to white women. And so we do really want to think proactively, not once we get there and the baby's, you're looking at the baby, you're like, okay, what now?
Wow.
But rather, prior to and developing that support network to think through their maternal mental health wellness plan before the baby's born.
That seems to be really key in prevention for sure. And you've talked a lot about social support and how important that is. And it sounds like from what you're describing, there are many routes to that. You've listed, someone you can confide in, or support groups, or family, or other care providers. Are there supports outside of social support that you recommend that you've seen to be supportive in either pregnancy or postpartum?
Yeah, so we know that when moms are supported, they do better in this transition to motherhood time frame. So there's actually a new program called Check on Mom that, for me, really provides great resources to help women and their partners think through the maternal mental wellness plan. And it really, for me, is all the things that I would want for a mom when she's pregnant to be getting in place. It includes resources, including a tool to help create a wellness plan for their emotional health, and that it helps capture each mom's needs. So it's personalized because each woman is different of what they might need or how they might prioritize things in their postpartum period. Women have the opportunity to designate a group of trusted friends and family known as a mom team. I so wish I had this with my two little ones.
Right.
I mean, I
might
had
still
support.
Need it.
Yeah, I know. Exactly. I was fortunate and I had family support who was there cooking me meals and washing my dishes and helping out. But if I had this beforehand, but it's to empower women for her postpartum period. The mom team is designated by the mom of people who could be helpful for her during this transition. They receive a bracelet as a wearable reminder to keep checking in on mom. And it's actually mycheckonmom.com. And
I love that.
Yeah. And it's, you could start in pregnancy and you can keep doing it, so everyone's ready for that fourth trimester and beyond. But there's also access to inspirational content and helpful information. I love that it's just educate. We got to overcome this. 9 in 10 women that don't want to ask for help. And so to say, yes, you're going to need this, and this is protective. And so there are, resources of, checking symptoms across the peripartum period. How do you track signs and symptoms of your mood? And then, knowing the signs, having the mom know the signs, but also her mom team. And they get this through resources on the mycheckonmom.com, but also you can sign up for text alerts that are really just full of education and resources. And, as I said, each mom's going to have different needs. They're going to want different people involved. And It might be that some moms need help with, like I did, with meal prep and dishes and laundry and just sort of, daily things. But it could be with older children. It could be with, other priorities, like, for women of getting a good night's sleep, to make sure that they're doing that, or taking a shower. No one knew it was going to be so hard to find time to take a shower or brush your teeth,
Yeah.
And so to have a team, a mom team ready to support you, checking in with you, it's part of the plan. There are no surprises. I think just provides tremendous support for women at this time of need.
That is an awesome resource. And I think the word you used and to empower moms is just so fantastic because sometimes when you tell someone that they need help, that that can register as like, well, I'm weak, or I'm not able to do enough, or I should be able to do it by myself. Baloney comes up. So that shifting that perspective to this being about empowerment and about having a healthy and happy or smooth transition into parenthood is really what it's about. It's not about somebody having some kind of weakness that they, need this team for. It's creating the village.
Absolutely. And, I think, again, we have to, we as women, I think, we can get the instructions, when we leave labor and delivery, or we have a home birth, we have some instructions of, sort of how to take care of our physical issues, from delivery. And, there's things that we need to take care of and do that. This is taking care of our brain health. And so having a plan in place to take care of our brain and to understand that pregnancy has physical effects from our brain to our toes. We got edema, and we got swelling in our ankles, and we have hormone changes in our brains. And so it's really, we have to think holistically about maternal wellness. And the Check on Mom program is a way of saying every mom deserves this. Every mom should be empowered to have this in place.
Oh, I love that. Well, thank you so much for that resource and for all of this information. I know for a fact that there are people out there listening who needed to hear this today and who learned something new. So I thank you so much for being with us.
Thank you so much for inviting me to talk about postpartum depression today. And again, I just want to encourage your listeners to visit mycheckonmom.com to sign up and learn more about how we can take care of our brain health during this such important transition in our lives.
Thank you so much.
Thank you again.
For anyone listening today who has resonated with any of the topics we discussed, is concerned for yourself or a loved one about symptoms of postpartum depression or any other perinatal mental health condition, please do consider reaching out to Postpartum Support International at postpartum.net. On there, you will find tons of information about what perinatal mental health conditions are, free support groups, as well as a provider directory, so that if you are looking for a perinatal mental health trained provider, you can look on that directory and find someone near you. I'm so grateful to have Dr. Deligiannidis on here to really give us more information about postpartum depression. These kinds of conversations are what we all need to hear so that we can understand what's going on for us instead of having to be surprised by it. Please do know the resource that she mentioned is available to you, as well as many of us perinatal trained providers are here and available to help you through whatever it is you're going through related to your pregnancy or postpartum journey. Thank you all so much for being with us. Until next time. Thank you so much for joining us today. Please share this podcast. Together we can support moms and families so that no one has to deal with this alone. Come connect with us at momandmind.com.